It is my absolute pleasure to introduce Dr. Felice Lynn. She is one of my colleagues, my esteemed, one of my great partners, and I've just been so proud to have her in our group, and someone who really focuses on heart disease from a women's perspective as well. She is extremely well trained. She is fellowship trained in advanced heart failure, heart transplant, and cardiovascular care. She completed an internal medicine residency, a cardiovascular fellowship, and advanced heart failure and transplant fellowship at the University of California, San Diego. Her personal interests include amyloidosis, which is a disorder of the heart, where accumulation of protein within the heart muscle itself, cardiomyopathy, weakness of the heart muscle, heart transplantation, cardiac allograft vasculopathy, and mechanical circulatory support devices. That means artificial hearts, right, to help you out. She's an active member of the cardiovascular care community. She's published numerous times in the Journal of American College of Cardiology, the Annals of Internal Medicine. She's also a member of the Heart Failure Society of America, American College of Cardiology, and she's a board member of our local American Heart Association. So it is my great pleasure to welcome her. Thank you.
All right. Thank you for that wonderful introduction, Dr. Daniele. And let me actually fix this real quick because I think I have this a little bit wrong here. Sorry, let's see. Oops. Oh boy. Let's see. There you go. Okay. Hopefully that's better. Sorry about that. Yes, so let me know if you guys can't hear me. But as Dr. Daniele said, my name is Felice Lynn, and I am a heart failure specialist. So the topic that I'm going to be talking about today is diastolic function in women, and kind of specifically, what is diastolic function? How does it actually contribute to heart failure? And kind of, as we've already alluded to, the importance of relaxation in multiple different ways. So, I don't want to get too technical in language, but before I start talking, I want to take a step back and just briefly talk about, what is the cardiac cycle and how does the heart work? So when we think about our heart beating, a lot of times we talk about our heart's function, right, which includes two different parts, actually. The first part where the heart squeezes and contracts the blood out to the rest of the body, and that's actually what we call systole. And then there's a second part where, after the heart contracts, it's called diastole, or in other words, this is the time where the heart relaxes and fills back up with blood in order to prepare for the next cycle and the next contraction, and so on and so on. And so when I talk about diastolic function, for when we talk about heart failure, I'm really talking about the relaxation state or the stiffness of the heart. So diastolic dysfunction is the impaired or delayed relaxation of the heart that results in incomplete filling of the ventricles. Not only is diastolic dysfunction an important part of the cardiac cycle, but it also plays an integral part in the development of congestive heart failure. And so therefore, it affects our survival and long-term outcomes. So kind of mentioned earlier, this is what we would call heart failure with preserved ejection fraction. A lot of times we think about it, it's characterized by diastolic dysfunction, where we're basically saying that the actual function of the heart or the way it contracts and squeezes is normal, right? So you don't have a weak heart. Instead, the heart is having a hard time relaxing and allowing that blood to fill adequately. And so this type of heart failure, I think gets put to the side a lot because the heart's not weak. However, it's also just equally as important as someone who has a weak heart. Approximately half of all heart failure diagnoses make up, or I'm sorry, what I should say is approximately half of all of our heart failure diagnosis is actually due to heart failure with preserved ejection fraction. And there is a very high female predominance. Women are affected two times more likely than men. So just kind of to put this into context, there's approximately 6 million people over the age of 20 diagnosed with heart failure in 2020. And we expect this to increase to over 9 million people in 2030, which is just a few years away. Okay. So what causes diastolic dysfunction? Kind of mentioned earlier, a lot of the same risk factors for cardiovascular disease or heart disease, blockages inside our heart vessels, contribute also to diastolic dysfunction. These include things like diabetes, hypertension, high blood pressure, obesity, right? They all contribute to impaired relaxation of the heart. And while these conditions affect both men and women, women who have these risk factors have a much higher increased risk in heart failure compared to men with the same risks. For example, if we focus on diabetes, right, people who have, or women who have diabetes have a 5-fold higher risk of heart failure compared to men who have diabetes. They have a 2-fold increased risk for heart failure, right? And the other thing too that we're also recognizing is that there are other conditions that contribute to impaired relaxation that either exclusively affect women or have a significantly higher predominance. And these conditions include autoimmune diseases such as lupus, rheumatoid arthritis, iron deficiency anemia, and lastly, preeclampsia, right? This is a condition that exclusively affects us women because it relates to high blood pressure during pregnancy. Obviously, men don't have that problem. So if we really look at all of this, women are at a huge disadvantage when it comes to heart failure with preserved ejection fraction. So what are some of the, so I talked a lot about the risk factors in women. I'm gonna take a focus on just the 3 big ones and look at them a little more carefully. So the first one, we know hypertension. We know that this is a condition that's very common the older we get, and therefore, as we get older, our risk of heart failure increases. But for women over the age of 65 years, there's a 3-fold increased risk of developing heart failure compared to men of the same age who have a 2-fold increased risk. Okay. When we talk about diabetes, it's actually more common in men. And as I mentioned earlier in the last slide, we have a 5-fold increased risk of developing heart failure, but men, 2-fold increased risk. And then if we decide to throw coronary artery disease into the mix or blockages inside the heart vessels, diabetes becomes the strongest predictor for heart failure in women. Okay. And then the last one that we really think about, obesity, plays another vital role in the development of poor relaxation of the heart. And we know that the prevalence of obesity is higher in women. And this is interesting to me because it actually, if we backtrack this, it starts early in adolescence, right? Where physical inactivity is much higher in females compared to men, right? According to this US federal activities guidelines, and they took a look at, a survey out there, 17% of women met the guidelines or the recommendations compared to 25% of men. So not great on both sides, but we're definitely lower and at a greater disadvantage. Okay. So I talked a lot about the traditional risk factors for both heart disease and heart failure, but we're also now learning about non-traditional risk factors that may be just as important or even more so. And these include things like depression and anxiety. Depression affects approximately 10% of the US population. And not surprisingly, people who have serious conditions and illnesses can become depressed. But what we are also recognizing now is that depression in of itself is a risk factor for the development of heart failure, and it has a huge impact on women. So just like autoimmune diseases, lupus, obesity, depression is a lot more common in women. Women are twice as likely as men to be diagnosed with this condition, right? And in approximately 20 to 40%, so almost half of patients who have heart failure either have depression or they develop depression because of their condition. And it's not just about the prevalence of depression in women and its effect on developing heart failure, but more and more studies are now showing that the severity of your condition and your symptoms of depression and anxiety kind of affect the progression of heart failure, and it can significantly decrease survival, as much as doubling the risk of death. So here, what we're seeing is worse survival in those with heart failure who have more severe symptoms of depression. So there's still a lot to be learned, I think, especially when we're dealing with how our mind and our body interact and affect one another. But I find, this is certainly an interesting connection, and we do need to talk more and more about this because it ultimately affects our health, our well-being, and increases our cardiovascular death. So I talked about diastolic dysfunction, the causes of heart failure, and the risks of developing this condition. What are some of the symptoms that we should really look out for in heart failure? Symptoms of heart failure are actually very broad and encompasses a lot of different organ systems as well too. For example, it can cause shortness of breath, either at rest, but more often we're thinking about it if you're exerting yourself. So whether you are just walking from the kitchen to the bedroom, you might start noticing, wow, I'm getting a lot more tired, or I'm getting more short of breath. I feel a little bit winded, like I just ran a marathon, but I only walked a few steps. You may also actually start noticing you have a difficult time breathing when you're laying down or while you're sleeping. And you're noticing that you're having to prop yourself up, and suddenly that recliner in your living room looks a whole lot more appealing than your bedroom. Similarly, because of all of these symptoms, you're not doing as much as you used to, and you start adapting. Instead of perhaps going to the mall or walking around the park, you know what? You're just going to say, I'm going to take a break today. And it slowly starts accumulating that way. You might start noticing that you're having some leg swelling or some ankle swelling in our feet. You may also start noticing that you're gaining some weight. But for whatever reason, you're also not having a good appetite anymore. You're feeling nauseous, or when you eat a small amount, you're getting full more easily, right? So these are all symptoms of heart failure. And you'll notice that, there's a lot of overlap with other conditions. And, I think for women, heart failure is not something that comes to our mind first. And so we may say, it's just because we're deconditioned. I just didn't exercise. It's because of the pounds that I put on over the last 2 years, without really realizing that this is heart disease and this is heart failure. And so this is definitely something that we have to pay attention to, especially knowing the higher prevalence of heart failure in women. So what are the treatment options? Well, if we go back to, the risk factors, you have to treat the underlying cause of what's contributing to heart failure. And heart failure preserved ejection fraction, so the relaxation or the stiffness of your heart. If we have diabetes, we got to make sure that our diabetes and our sugars are well controlled. If we've got blood pressure issues, we got to make sure that that's also well controlled as well too. Right? Making sure that all these other comorbid conditions and making sure that they are well controlled can delay the progression of heart failure. Or if you already have heart failure, improve your symptoms, and you can find that you actually can do more. But by this point, we're being reactive to a condition that we've already developed, right? And it's, better to treat things that come, it's better that we're treating it and that everything's well controlled. But if we can do something to prevent the development of heart failure, or, something that requires us to be proactive about our health, I would say that's going to be so much better, right, than being reactive to something. And so we have to remember that sometimes, right, we have to be proactive. We got to be able to develop certain lifestyles or certain habits that can stave off some of these risk factors and ultimately prevent the development of heart failure. And so what does that actually include? And this, I would say, is going to be more the focus that I really want to emphasize for us, that how we live our lives really plays a major role. Like what we're eating, what we drink, what we do is just as important. And I probably would argue it's more important than the medications that I'm giving to my patients, right? Because it's easy to take a pill, or easier, I will say, to take a pill, right? To do what you're supposed to. But I think to incorporate, lifestyle changes and know that there's certain things we're not supposed to do, or certain foods that we have to stay away from, right? That takes a lot more discipline, because it's all encompassing for our life. It's 24/7. Going to the doctor's office takes maybe 30 minutes of your time, right? But to live, that's, like I said, 24/7. And so that requires a lot of discipline. And we all know that that's not as easy as it sounds, right? So what I'm trying to get at is there are programs out there such as cardiac rehab, and exercise programs and kind of support groups, all addressing this issue and really helping us stay on track, helping us incorporate healthy life tricks in order to live a longer and healthier life, right? It's not just about medications. It's not just about the conditions. It's also managing, what goes on in our daily activities, our interactions with other people, and our family and friends. And so want to focus on something called cardiac rehabilitation. Cardiac rehab is a medically supervised exercise program, but it's so much more than just exercise. The emphasis is on developing a healthy and balanced lifestyle. So the focus is going to be on 4 pillars of life. Exercise is one of them, yes. Nutrition, stress management, and support groups, right? So kind of these big 4 parts that we all need to do better at in order to, to balance it all out. And so, you know, exercise isn't just something that makes us feel good or helps us with weight loss. There's a lot more research now showing that there is benefit with exercise, in improving our heart function. In this case, our heart's way of relaxing, or the stiffness of that heart, that diastolic dysfunction or dysfunction in those with heart failure. We're learning that some kind of exercise training, whether it's walking, yoga, ellipticals, whatever it is, we're learning that it does help with the way our heart relaxes, and you can actually feel better. You're able to do a lot more. The way I think about it, we know that when we exercise, when we go to the gym, when we're doing some kind of physical activity, we're training our muscles, right, to do more, to, have more resistance, to be able to get stronger. Our heart is just like any other muscle, right, in our body. And just like, how we use exercise repetition to improve our body and our muscle strength, the heart also needs that as well too. And so exercise, whatever activity, it doesn't have to be, an hour long every single day, or 3 hours of hiking up Yosemite. It can just be a 5-minute walk that you normally wouldn't do a day, right? And it's all about incorporating little tricks in your life so that you can do more, that we can actually give our heart some exercise that it needs. And so you may be wondering, well, how much is enough, right? And I even mentioned that when I talk to some of my patients, I tell them, I don't necessarily want you to join a gym if you don't normally join a gym. I don't want you to necessarily buy a treadmill just to, sit in your room there, and it becomes like a clothes hanger. But what I'm really trying to do is incorporate little things into your life. So for example, right, when we go to the doctor's office, when we go to the stores, I think instinctively we always look for the closest parking spot, right, to the door so that we can walk less. Well, what about if we just park a little bit further away, even if it's just a couple cars down, not that much longer or not that much farther? It's still a couple more minutes into your life, right? That you have to walk from the car to the building, whether it's the grocery store, the doctor's office, you have to make that walk. So like those are little things I typically try to incorporate or at least recommend. But there's also, there are guidelines that our professional societies do recommend. And the big question of how much is enough, what's, professionally, I will say the American College of Cardiology and the European Society of Cardiology both recommend that we get at least 150 minutes of moderate intensity exercise per week, or you do 75 minutes of some kind of strenuous exercise. Now, what do we define as moderate or strenuous? Things such as bicycling, walking, swimming, these are considered moderate intensity exercise. And I put in yoga there just because of the last slide showing that yoga and meditation seems to also help with diastolic function as well too. When we're talking about strenuous activities or strenuous exercise, these include, things like jogging or some kind of recreational sports, whether it's tennis, basketball, all of these other things. And I recognize that not all of us are going to be able to do these high impact activities, right? We may be worried about, breaking our hip or falling and our balance is not great, right? So what do we do in that situation? Well, the European Society of Cardiology actually goes a step further and acknowledges that. And it's, just recommends that in those situations, perhaps what we can be thinking about is more of a gait training, right? Some kind of exercise to improve our balance. These are ways to help us improve our strength, improve our endurance, increase our bone strength as well too, to prevent osteoporosis. But that way you're also getting the benefit of increasing your heart activity, for your cardiovascular health. I do also have some patients who ask, well, I can just do 150 minutes of moderate intensity exercise a week. That's no problem at all. But should we just limit ourselves to the minimum requirements? And again, that's the one thing I want to emphasize, is that these are just the minimum requirements that they recommend. If once you meet the 150 minutes of moderate intensity exercise a week, which if you break it down into 30 minutes for 5 days a week, the European Society of Cardiology actually says, try to go a step further and encourages that we try to then double up on it, right? Because the more we can do, the more active we are, the better it is for our cardiovascular health. And so they will actually say, try to increase our endurance to, 300 minutes a week of moderate activity, or, 150 minutes of strenuous activity, if we can. Okay. And so, I know that cardiac rehabilitation, I said, is not just about exercise. And I spent the last few minutes focusing on exercise and physical activity. It's also important to balance that with diet, right? With nutrition. What we put into our bodies with food is just as important as the medications that we are prescribed or that we are instructed to take by our providers. And besides diet and exercise, what we need to be able to do is manage stress and our mental health, right? Because all of this plays a major role into contributing to living a healthier and more balanced lifestyle, right? Which ultimately will translate into improving our symptoms of heart failure and also bettering our cardiovascular health. And so, kind of like what Dr. Daniele mentioned, a lot of times when I'm talking to my patients, not just about their heart failure diagnosis, I'm also talking about stress. I'm talking to their family members. And because it's not just one person, it's their support group, right? How are they expected to succeed if, their family member who does the cooking is not helping or buying into this program as well, too? So I think it requires a lot of people, a lot of help from everyone, not just one individual. All of these, like I said, is very important, and how we manage our stress is going to, ultimately help with how we feel down the road. So, in summary, diastolic dysfunction is kind of the impaired relaxation of the heart, and it contribute to the development of heart failure. We know that risk factors for heart failure or diastolic dysfunction, unfortunately, disproportionately affects women: diabetes, obesity, depression, autoimmune diseases. And as a result of this, there is going to be a higher prevalence of diastolic heart failure in women. Besides medications and the treatment of these individual risk factors, right, a focus on living a healthy and balanced lifestyle by focusing on exercise, nutrition, and stress management can improve not just symptoms of heart failure, but you can delay the progression or the development of heart failure, right? And by doing so, you're going to reduce your cardiovascular mortality. You're going to improve kind of your quality of life. Because I think one of the biggest things for heart failure is, that most patients come to me is they recognize that there's a decrease in quality of life. They're not able to do the things that they previously were able to do. And so, it's great to be reactive. We can give you medications to make you feel better once you have this problem. But I think one of the things we all have to remember is if we can do something early, starting in our adolescence years, being a good, role model for our daughters, our nieces, our granddaughters. Because like I said earlier, obesity and some of these risk factors start early. They start when we're young. So if we can start even from the beginning, hopefully we can stave off heart failure, and you won't have to see a cardiologist or myself as a heart failure physician. So that's all I have. Thank you so much.
Thank you, Dr. Lynn. That was an excellent overview and presentation on the importance of maintaining a normal relaxation and normal elasticity of the heart muscle. And if you can see a trend here, it's very easy for us to give you as many medications as you will and start patching up the issues as they come along. But really, we really need to get to the root cause here and remember that self-care has never been so important than it is now. We have rising issues and stress all over the place. And we really need to step back and think about ourselves and what we're doing, because as much as we love taking care of all our wonderful patients, and we would much rather see you and be preventative than picking up the pieces during a catastrophe and ongoing chronic illness. So I appreciate it. Thank you.